This is a really exciting topic that we at Longevity have really spent some time learning more about. We've had several guest speakers in our meetups and through different things that we've done, and we are very excited about introducing Kim Lowry Walker to help us really understand integrative medicine and how it can complement traditional treatment and really enhance quality of life. So Kim is a licensed clinical social worker and integrative oncology program manager at Innova Peterson Life with Cancer, and survivor Cheryl Kellum, who has also been involved with integrative medicine in her care, will help moderate your questions. If you are just joining us, hopefully you have downloaded the Event Mobi app. You can follow the agenda there. You can read the full bios of all of our speakers this weekend there. And it's a great way for us to submit questions. And that's Cheryl will be looking at the app and reading your questions to Kim as they come in. So I'll give it to Kim. Take it away.
Wonderful to be here with you all this afternoon, so thank you so much for having me. As Anne said, my name is Kim Lowry Walker. I'm a social worker by training, and my role at Innova Peterson Life with Cancer, which is an organization just in Northern Virginia, not too far away. So I'm an oncology therapist, but also I'm a integrative psychosocial oncology program manager. So it's a big mouthful. But as part of that, I manage kind of some of the integrative programming at our organization. I also completed the Integrative Oncology Scholars Program at University of Michigan, and I'm currently co-authoring a textbook chapter on integrative approaches to stress. So this is one of my passions, and I'm really excited to share more of that with you today. So first, I just want to cover a little bit of definitions. So the title of this presentation was around integrative medicine, and you'll hear me say integrative medicine and integrative oncology interchangeably during this presentation. So integrative oncology is just one branch of a broader field of integrative medicine. So what is integrative medicine or integrative oncology? First, let's talk about what it is not. Okay, so it is not a replacement for conventional treatment. We are not talking about a cure for cancer. We are talking about real evidence-based strategies for helping to support the cancer journey. So a little bit about that. You can think of it as this integration of conventional treatments with integrative or complementary modalities, with the aim of really improving overall well-being and quality of life. As I mentioned, they are evidence-based things, so we will talk a lot about the research and the evidence out there. And unlike maybe traditional oncology, it addresses the whole person. It really keeps in mind, body, and spirit, which sometimes the traditional medical model doesn't always do a really great job with. So, some of you might be saying, if you're not familiar with this field, so what the heck is she talking about? What are integrative oncology modalities or approaches? What are these things? So I'm going to have come up on the screen here just a few examples of all the things that fall under the umbrella of integrative oncology. And this is not even everything. There's probably 100 more things that you put up here. Okay? But some of these might be familiar to you, some maybe are brand new. And we'll be talking about a few of them that have the most evidence around them today. But before we do that, we're going to try something brand new and do a quick poll in your Event Mobi app. So you can get out your phone, and if you go to the agenda and navigate to this session, one of the tabs across the top will be the poll tab. And there we have a quick poll, and we'll be able to live see the results of this poll. Okay, so we have a lot of regular users of integrative modalities here. A few skeptics. I love it. Yeah, so it's looking like about 2/3 of the room are regular users of integrative modalities. And we will talk a little bit more about how that matches up with some nationwide data, too. Okay. And for the skeptic in the room, I hope you'll have your mind expanded today. So you guys are pretty much on track with the national numbers. So 2023 study showed that 50 to 80% of people going through cancer treatment were pursuing at least one integrative modality. And when I looked up specifically for the lung cancer sphere, that number was about 50%. So with you guys at about 2/3 of the room who are regular users and another 10 or 15% that have at least tried it out, that's pretty much on track with the national statistics. And so because of this really large interest in these modalities, that's really what's driven a lot of the research and new things coming out in this field. So how can these modalities help? Okay, so here are a few of the common symptoms that might be happening both during treatment and after treatment where integrative modalities can be helpful. So we've got pain, mood, and under mood, I lumped together concerns around anxiety, depression, and stress. Brain fog, you might have also heard of that as cognitive impairment. Okay. All the GI issues, so ranging from constipation to loss of appetite or nausea, fatigue and sleep issues, and sexual side effects. And what's interesting about this list is that the things on this list don't have necessarily one specific cause. They can have lots of different causes that are all overlapping. So the cause could be cancer itself. It could be a side effect from treatment. It could be a psychological side effect from sleep, from lack of sleep, okay, or from your treatment. So, and all of these things can also impact each other. So as an example, if you're experiencing pain, that probably is going to affect your mood. Right? You're probably not a little stressed out if you're in pain a lot, okay? It might also affect how clearly you're thinking. It can maybe affect your appetite. Maybe it's going to interrupt your sleep. So all these things are interconnected. And whenever you have a symptom that doesn't necessarily have one clear cause, that's where integrative modalities can come in, okay? It's not something that you can just fix with a pill or fix with a medication. You've got to approach it from a lot of different angles. And this is where a lot of people start looking for different ways to solve the problem. So talking a little bit about the evidence that's out there, I'm going to highlight two things on this list in particular, so the two things in green. So there's an organization out there called the Society for Integrative Oncology, and they have partnered with ASCO, which many of you might have heard of, so the American Society of Clinical Oncology, and they have printed each year, the past 3 years, joint guidelines for the use of integrative modalities. So they currently have published guidelines about the best evidence around fatigue, anxiety and depression, and pain. And those are kind of the leading edge where a consensus of people have come together and said, where do we have the best and most evidence for how to address these symptoms? Okay. Now, I was looking as part of this presentation to say, well, what about for lung cancer specifically? And in fact, so CHEST, the American College of Chest Physicians, did also publish a similar set of guidelines around integrative modalities, but it dates back to 2013. So it's a little bit outdated. So I'll be referencing both of those things kind of throughout the presentation. But these are really great kind of consensus things that you could bring to your medical team if they're skeptical about any of these modalities too. So all of that said, I admitted that this is my passion field, but I also want to be realistic that there's some evidence limitations here, okay? So the first thing is a lack of funding for the research around these kind of modalities. So there's not a big pharmaceutical company who's really interested and invested in researching the benefits of yoga, for example, okay? And so because of that, there just isn't the same amount of funding for these modalities as there is for more traditional medicines. That is also tied to then a lack of quality of evidence. Okay, so the kind of the gold standard for research evidence is a randomized controlled trial, and everything I'll be talking about is backed up by that level of evidence. That said, there's lots of modalities out there that are just researched by maybe smaller studies, little one-off things, and so that doesn't mean they don't work, it just means that we don't have lots and lots of evidence around it. Next is differences in implementation. So unlike a standard drug or a pill, there's a lot of different ways that these things can look. So let's take the example of music therapy. Maybe some of you have had a music therapist come by like during chemo or while you're in the hospital, okay? Music therapy can be administered one-on-one, it can be in a group setting, it can be a one-time intervention, it can be an 8-week intervention, it can be for 15 minutes or it can be for an hour. So there's lots of different ways that these things can look, and so as a result, it's a little bit tricky to compare apples to apples when you're looking at the research. Okay? So just keeping that in mind as we talk about the evidence out there. And then lastly, the lack of diverse samples. I just caught the end of the research talk where they were also talking about the lack of diversity in research, and integrative research is no different. The biases in the research tend to be towards breast cancer, and they tend to be women. Okay? So other types of cancers in men just isn't quite as robust of an evidence base out there, along with other communities that aren't as well represented. Okay. The other big barrier is access to these modalities. Okay, so some good news and some bad news. So some good news is that if you happen to live near one of the top 10 major cancer centers in the US, almost all of them do have integrative oncology or integrative medicine clinics where you can access some of these services, okay? Now, I'm gonna guess that a lot of you don't live near one of those centers, but for those who, that doesn't mean they don't exist, but it's maybe a little bit harder to find. The next barrier is cost, okay? So some modalities might be covered by some insurance, might be covered by a flexible spending account, but oftentimes cost is a real barrier to accessing these services. So cost and availability of skilled practitioners continue to be the biggest barriers for people who maybe are interested in pursuing these modalities, but just can't access what the treatment they want. So with that, we're going to dig into some details. I've chosen to focus on 3 integrative modalities where we have really, really robust research that are really also a little bit easier to access than maybe some of the other modalities. Okay. So first, a disclaimer that nothing in my presentation should be considered medical advice. As I said, I'm a social worker, I'm not a doctor. So keep that in mind, and please make sure to talk to your own medical team. Okay, so first, mindfulness-based interventions, also known as meditation, okay? You'll see up here 4 different names of programs and a bunch of acronyms, just so that you all can see all the different types of mindfulness-based programs that are out there, and this is even just a sampling. But the one I'm gonna focus on today is the first one, which is mindfulness-based stress reduction, okay? So I talk to people in my job a lot about meditation and mindfulness, and I hear a lot of myths around mindfulness. So the first one that I hear is, oh, I can't get down on the floor like that in that nice lotus pose with my back straight, like I can't do that, so I can't meditate, okay? The next thing I hear is, well, I don't have a perfectly peaceful place in my house where there's no noise, and I don't have 4 hours of my day to meditate, so I can't meditate, okay? The last myth that I often hear is, I can't make my mind blank. My mind is always going, it's not just this blank open sky, so I'm bad at meditating. I tried it once, it doesn't work for me, okay? So this is what mindfulness meditation can really be like. So I love this picture of somebody's brain just all full of noise and colors, okay? You've also got somebody sitting there saying, like, what's for dinner? What was that smell? How long have I really been sitting here? Is my time up yet? So like, the reality is that all of our brains are going all of the time. We're not gonna shut them down. Maybe we can try and focus and quiet a little bit, okay? But our goal is to not stop thinking, okay? You have big, beautiful brains, we want them to be thinking, okay? You also don't need to be in the perfectly peaceful place with no noise and in the lotus position. You can be laying down on your couch in your favorite comfy chair. You can be out taking a walk in the woods, okay? Meditation can take lots of different forms. It doesn't have to look one specific way. So let me tell you a little bit about mindfulness-based stress reduction. So I mentioned earlier that one of the biggest barriers to research is the kind of differences between how things are done. And you can imagine that this also applies to meditation, right? Like, am I meditating every day or once a week and for 5 minutes or for an hour? And so part of the way around that is this very structured, standardized program called mindfulness-based stress reduction. And because it is structured and standardized, there has been a ton of research around this program, okay? It's a 6 to 8 week program that combines mindfulness, yoga, and psychological theories. It was developed by this lovely gentleman, John Kabat-Zinn at MIT. He was trained in Buddhist mindfulness meditation, and he thought it was really powerful, and he said, you know what, I really want to bring this into my current setting, but I'm realizing that nobody's going to buy into it if I say it's Buddhism. So he basically made it into the Western medical model, kind of shaped it into that, so it is a completely secular program. Okay. There's also now a variant of this program called mindfulness-based cancer recovery, follows a lot of the same structure, but is really geared towards the cancer experience. So what's the evidence? How can it help you? Okay, so not surprisingly, mindfulness-based stress reduction is really great at reducing stress, okay? That also applies to anxiety and depression as well. So some really strong evidence around that. To the point that they've even done testing on biomarkers using people's like saliva samples and blood samples and shown that it reduces levels of cortisol in the body, improves immune function. It can be a really powerful tool. Okay. The other place where the evidence is the strongest is around fatigue, which kind of surprised me, to be honest, as I was kind of putting this together. Is that if you are suffering from fatigue, if that's a problem for you, then meditation might be the solution. This is maybe not totally intuitive, okay, but really strong, really great evidence on that as well. When it comes to sleep quality, which is a little bit different than fatigue, there's a little bit weaker evidence, but might also be helpful for you. Okay. Some safety considerations. If you do have a history of significant trauma in your background, then a group setting might not be the most appropriate for you. And so working one-on-one with somebody might be better. And if you are struggling with shortness of breath, a lot of meditation practices do focus on the breath, and so you might just need some modifications. Totally doable and totally fine, but just something to be aware of. So how to access it? So if you are somebody who likes being in a group setting, okay, there are lots and lots of local hospital systems that offer this program. There might be a meditation center or retreat center in your area where you can find this program, or even therapists in the community also run this program. Now that said, there's oftentimes a cost to this program. When I was looking, it looked like between $500 and $600 for the 8-week program. So not inexpensive. If you're more somebody who says, no, I don't want to be in a big group, I'm just going to do this on my own and play around with it, there are options for you to do this on your own at home, okay? So I mentioned mindfulness-based cancer recovery. There's also a book with that same name with some online modules that you can read the book and follow along the online modules. There is a website called Palouse Mindfulness that puts all the materials and recordings of the meditations up online that can be really helpful. And then, of course, there's a million apps out there for meditation. So none of them have the actual full 8-week program on them. But if you just want to dip your toes into meditation, apps are a great way to get started. Okay, so John Kabat-Zinn, the founder of the program, does have his own app called JKZ Meditations. Some other popular ones are Insight Timer, Calm, and Headspace. I will highlight that Insight Timer has a mostly free option, so it's a really great library. Okay, so moving on now to acupuncture and acupressure. Okay. I love this particular meme because I think it really captures what I hear from people when they've never done acupuncture before, what they think acupuncture looks like, versus people who are totally bought into acupuncture, what their experience is really like. Okay. So a little bit about what acupuncture is. So it is part of traditional Chinese medicine, and practitioners believe that the acupuncture can help balance the flow of energy or qi throughout pathways and meridians in the body. If you get somebody with a little bit more of a Western medical bent, they might say that acupuncture accesses nerves and tissues and muscles and different connection points throughout the body. So I'm going to guess that a lot of you in this room haven't done acupuncture before. From those stats, maybe some of you have. But in case you haven't, and it sounds terrifying, I just wanted to break down what to expect and what it actually looks like to get acupuncture. Okay. So first, the acupuncturist will insert some very thin needles, relatively shallow at strategic points throughout your body. Okay. You might have a little bit of discomfort, some mild aching. It's not like getting a shot, though. Okay. They then might manipulate the needle in some way. Sometimes they move it a little bit or twist it. They can even apply heat or electrical impulses to the needle. And then you just chill out for a little bit. Okay. You hang out there and relax for maybe 10 to 30 minutes, depending on the setting. And then they take the needles out, and that's it. Now then, there's also acupressure. So for those of you who hate needles, acupressure might be the better option for you. So it follows the same principles as acupuncture, but uses pressure and massage on the same points in the body instead of the needles. Okay. So what's the evidence around acupuncture and acupressure? Also, maybe not too surprisingly, pain is where we have the most evidence for the efficacy of acupuncture. It is strongly recommended, really strong evidence around that. In fact, one study found that people getting acupuncture for musculoskeletal pain, so basically muscles, joints, and things, had effects up to 6 months after their sessions. Okay, so a long-lasting impact on pain. The other place where acupuncture is the strongest is nausea and vomiting. So particularly chemotherapy-induced nausea and vomiting. Really strong evidence that both acupressure and acupuncture can be helpful in relieving those symptoms as well. Where the evidence is a little bit weaker but also promising is around fatigue and sleep and also mood. So those are things that it's maybe not the first thing to go to, but if this is interesting to you or you're getting it anyway for pain or nausea, it might also have benefits in these areas too. And so I'm going to teach you all a little acupressure. Okay. So this graphic comes from Dana Farber, and this is just to access an acupressure point that can help with nausea and vomiting. Okay. So if you just take your hand, maybe not the one with the watch on it, and you're going to measure 3 fingers down. Okay. Right in the middle of your wrist, 3 fingers down, there's 2 tendons, and right in between that tendon is an acupressure point that you can just press or massage for a couple minutes, and that can help relieve nausea and vomiting. So this can help with the chemo-related nausea vomiting, but also even just motion sickness. Okay, so if anyone's ever heard of C-bands, okay, it's a little wristband with a little plastic ball on it that goes right in that spot. Okay, so those are basically acupressure bands. Okay. So this is the nice thing about acupressure is that it's a really simple, easy, portable thing that you can do without needing an expensive practitioner. Okay, so this is one really useful one. I've even used it with my own kids in the car. Some safety considerations with acupuncture. Number one is absolutely imperative to have a trained, certified, insured acupuncturist. Ideally, somebody with oncology experience. That might be harder to find, maybe take some asking around to find, but it's also very important. Some side effects you might expect is some soreness, some minor bruising or bleeding, but really relatively minor. I will say there's a few cases where acupuncture is not appropriate. So if you have a particular like skin infection or a wound, it's not appropriate to do acupuncture around that wound. If you have a pacemaker, or if you're severely immunocompromised. Okay, those are some situations where you wouldn't want to do acupuncture. Okay. Also, if anybody's pregnant or is planning to become pregnant, acupuncture has been known to induce labor, so be careful with that. So how to access it? So acupuncture is one of the therapies that might be covered by your insurance. Okay, it's not covered by Medicare, but if you have a private insurance, some private insurances do cover acupuncture. And a lot of flexible spending accounts, if you have that, also cover acupuncture. Your local integrative medicine or oncology department, if you've got them at your medical center, might also have it available for you. And then there's also this website of a directory of acupuncturists that can be a great way to find an acupuncturist that is certified and licensed and trained near you. Okay, so next we've got yoga, okay? So yoga is maybe a little similar to meditation that I hear a lot of people say like, well, you know, like I've tried yoga, but you know I can't do a handstand, so I can't do yoga, right? I've tried it. So what is yoga? So just to expand our concept of what yoga can mean, it is a mind-body practice that can combine movement and breath practices and meditation. But there's a really, really wide variety of what yoga can mean. And so don't believe what you see on television. Like there's a lot of different ways that yoga can look. So even in these pictures, we've got people using chairs to do their stretches, okay? So where can yoga be the most helpful? Fatigue after you're done with treatment. So this is a really interesting distinction, is that they kind of studied people about experiencing fatigue both during treatment and after treatment, and found that yoga was the most effective and had the best evidence after people were done with treatment. And it also had some, not as strong, but some evidence that can help with those mood concerns, so anxiety, depression, and stress. I did want to highlight a few studies that I found that were specific to lung cancer that I found really interesting. Okay. First, in 2024, so just last year, there was a study of lung cancer patients who were undergoing surgery. And they had them do yogic breathing exercises before and after the surgery. And they found that the people who did the breathing exercises had a significantly greater improvement in shortness of breath and in their anxiety, two things that often go together. Okay. So that was an example of where yoga was used not for the movement part so much, but more in the breath practices. Okay. A 2021 study of partner-supported yoga among lung cancer patients found that after a 12-week program, so pretty long, so 3 months or so, people experienced a really wide range of improvements. So improvements in fatigue, depression, sleep disturbance, but also strength and cardiovascular endurance. So there is a lot of overlap between exercise and yoga, not always, but sometimes. And so it can be helpful if you're looking for those exercise benefits as well. Another study from last year, also a pretty small study, but around partner yoga, where partners in the program had a significant decrease in depression and an increase in quality of life after completing the program. And what I really found interesting was that this, unlike a lot of different modalities, can be something that's done with family members or with your partner, okay, and can have benefits for both people. So it's not just for the person undergoing treatment or who has gone through treatment, but really can be for the whole family even. Some safety considerations. So as yoga can be considered a form of exercise, I work with a lot of oncologists who joke that when they don't know what to recommend to their patients, they just say, exercise as tolerated, whatever that means. So yes, do whatever, listen to your body, listen to how it's responding, and exercise and engage in yoga as much as feels comfortable for you, okay? Talk to your medical team about any restrictions that you might have. Also, if you're concerned about infection risks, then maybe an in-person group isn't the best idea, maybe an online option would be better. So in terms of access, yoga is probably one of the things that is the most easily accessible of the different modalities. That said, if you do require significant modifications, it might take a little bit more research and more work to find the class that's right for you. So you can look for keywords like gentle yoga or chair-based yoga or senior yoga. Okay. All of those probably include some modifications for different mobility levels. Okay. I also have up here, there are a lot of apps up there, but to use caution. So if you are new to yoga, trying to do it by yourself through an app might be a little bit risky, so I would recommend instead connecting with an licensed instructor one-on-one. So just a few guidelines across all of the different modalities. So these three plus all the ones that I had on my slide at the beginning, okay? So first is to weigh the benefits versus the risks. So one thing that's really great about integrative modalities is that with a few exceptions, there's not a whole lot of side effects, okay? So even if you're not totally positive it's gonna work for you, you can try things out without a lot of downside. The one exception to that might be herbal supplements and things like that, which I will honestly say is not my area of expertise, and that is one area where you want to be very careful about interactions with drugs you're on, okay? But things like yoga or acupuncture or music therapy or art therapy or Reiki or things like that really don't have much side effect, okay? So even if you're skeptical, you can give it a try without a lot of risk of harm, okay? Next is do what works for you. Again, kind of unlike what your oncologist is telling you to do, you've got a lot of choices here, okay? So if you just say, needles are not for me, there is no way you're gonna get me to do acupuncture, Kim, fine, okay? There's lots of other options out there. Next is work with your medical team. I'll list some resources up here too, so talk to your doctors and nurses and kind of your whole team about what you're looking for and what maybe relief from symptoms you're looking for. And tell them what you're interested in, okay? And if they're skeptical, we've got some resources there that might help convince some people, okay? And lastly, look for some qualified practitioners. So there are a lot of people out there who maybe aren't qualified to practice these modalities, and so it is important to find real certified or licensed or trained practitioners in these areas. So some resources for you. I'm had up earlier on the slide that so NIH has a National Center for Complementary and Integrative Medicine, so that has a lot of great resources and research on it for you. Those SIO, ASCO guidelines, physicians help develop those, so physicians tend to like those guidelines. If you're looking for more information on exercise, ASCM, I can never remember exactly what that stands for, but the College of Medicine, Sports College Medicine, something like that. But they have a set of guidelines around exercise and oncology that are really great and really detailed that you can bring to your oncologist. If massage is something you're interested in, there's actually specifically a Society for Oncology Massage with a directory of practitioners who are certified in oncology massage specifically. Cancer Choices is another great website with a lot of different information and resources around a whole wide range of integrative modalities. And last but not least, I will give a shameless plug for my own organization, Life with Cancer. We offer a lot of these modalities. Almost all of them are open to people no matter where they're getting treatment from. I do mindfulness-based cancer recovery online. No matter where you are in the country, you are welcome to join us. So check us out too, and especially if you're local in the area. And with that, time for questions. So, I'll hand it over to Cheryl, who's going to be our moderator for today.
Thank you, Kim, for the wonderful information on integrative med services. We have some great questions. I have appreciated integrative med because I have participated in some of those services. So I'm looking forward to seeing all the questions. First, how do I know if an integrative therapy is real and not a scam?
That's a great question, and something that's, I think, really important. So number one, I would talk to your doctor about it. Okay, so they are probably up on the latest research. If you feel comfortable Googling and looking for the research yourself, I wouldn't accept case studies or testimonials necessarily from people, but real independent, randomized controlled trial studies with a big sample. Okay, that's what you're looking for some real proof about the efficacy of different modalities. Okay. One thing, as I said earlier, that's a little bit tricky is that sometimes there are real scams out there, and sometimes there are things that just haven't been really well researched, but that doesn't mean they don't work. And so just to check and see what is the research out there around these things is really important.
Do cancer patients need specialized massage therapists, or is seeing a regular massage therapist okay?
So it kind of depends on where you're at in your treatment journey. But I would highly recommend somebody who is certified or trained in oncology massage specifically. They can work with lymphedema. They can work to make sure they're respecting, if you have any scars or surgical issues going on, they can be really, really good about it. That doesn't mean that someone who's not trained in it isn't also wonderful, but you have an extra layer of certainty or protection if you know they've been trained in oncology massage.
Okay. What can you say about cannabis?
Cannabis, okay. I almost included cannabis in my presentation here, but I did not, so it is not my area of expertise, I will honestly say. However, SIO and ASCO, who published those guidelines I talked about, also recently published guidelines around cannabis. So I'd recommend Googling that, SIO, ASCO, cannabis, and you can find some of the latest research and recommendations around the use of cannabis.
Is there any evidence that Reiki is helpful for pain, mood, brain fog, fatigue, and sleep issues?
Okay, so for Reiki, I will say it is tricky with Reiki because there's not a ton of research out there, just because it's, again, like who's gonna fund Reiki research? Like it's harder to get funded to do big research studies around it. That said, some of the preliminary kind of promising research around Reiki is that it can help basically with anything that will help with stress, okay? So mood issues for sure, could help with pain, and fatigue and sleep, I would say, are probably the top with Reiki. But again, kind of emerging research around that.
Can acupuncture or acupressure help with shortness of breath or ease breathing?
Great question. So I actually tried to find research around that specifically and didn't find a lot of great research. Again, that doesn't mean that it's not helpful, but just means we don't have a robust research base around that specifically.
Okay. What is the herb app that you mentioned on the last slide?
Yes, sorry, let me see if I can go backwards here, hang on. Oh, no, they switched it. Thank you, I skipped over that one. So if you are interested in herbs and supplements, Memorial Sloan Kettering in New York has put out an app called About Herbs, and it lists just tons and tons of herbs out there and what they can be helpful for, and also how they shouldn't be used or possible side effects. So it's some basic information. It's not a substitute for going to talk to somebody with really deep, in-depth knowledge, but it's a great starting point if you're curious about herbs.
Do I need to consult my care team before starting any integrative med services? And are there any that I don't need to participate in?
I would say it probably depends on how invasive they are. So if you think about something like Reiki, there's not going to be any interactions with any medicines that you're on, basically zero risk to that. And so I would say no need to talk to your medical team. If you're talking about something that's movement-based, like yoga, yes, talk to them about any restrictions that you might have. Acupuncture, again, if you're going to pierce the skin, maybe talk to them about acupuncture more than acupressure, okay? So just thinking about the risks for each modality will help guide kind of when you should talk to your medical team about it. But it's never a bad idea to mention it, too.
Okay. And then tagging onto that question also is, what is the easiest one to learn and get started with?
Oh, that's so tough. That's an impossible question. I would say the one that you're interested in and the one that you can find near you is the best one to start with, okay? Which is probably going to be different for everybody in the room. And I'm happy to talk to people afterwards, too, if you've got specific questions around things. My passion's around meditation. That's also something you can kind of do any place, anywhere. And it's a kind of a good way to dip your toe into things.
Do I need to consult my care team before starting any integrative med services? Oh, thank you. Is general and/or strength training considered a viable integrative approach?
Yes. So exercise is actually the absolute number one thing for fatigue, for example, which is exactly when you don't want to do exercise is when you're fatigued, but it's the thing that will help you the most, okay? So I mentioned these ASCM guidelines have really great detailed information about kind of considerations about like different phases of treatment, or if bones are involved, kind of how to modify and things like that. So that's can be really, really helpful guidelines for how to integrate exercise safely to support your symptoms. I will say, depending on the symptom you're looking for, the side effect that you're looking for relief from, or what that's bothering you the most, will impact what kind of exercise you do. So for example, if you're looking for specifically like kind of stress reduction or improving anxiety, depression, it's actually the combination of aerobic exercise and strength training that's shown to be the most effective.
Who pays for integrative med?
Usually you, is the hard part, yes. So in terms of insurance, I think acupuncture might be one of the only ones. I actually do know of a couple of insurance companies that might pay for like meditation apps I've heard of, like a yoga app. I've heard of some private insurance companies paying for those, but usually it's out of your pocket. If you're in the area, Life with Cancer services are all free, so nobody has to pay. So does donors pay for it for you? But yeah, that's the unfortunate reality, is that it's usually out of your pocket.
Are there any nonprofits working on offering these modalities at in a cancer-specific app?
Oh, specific app. Not that I know of. It's an app-based thing. So, so there are a couple of apps. So for example, like Insight Timer has like courses and things specific to like pain management and things like that. But it's not necessarily, I think there is even a cancer-specific kind of course or track within that. But I think that is even for a fee. I don't know of any particular apps in this area. Yeah, but check out Cancer Choices. I'm not sure if they have an app, but their website is a really great resource as a nonprofit.
What is the best way to be a part of the research for integrative oncology?
That is a really great question. So if you are located near an academic medical center that has an integrative medicine department or an integrative oncology department, that's a great way. Also, the Society for Integrative Oncology has patient advocate memberships. And so when you, like their annual conference, they have lots of patients there as well. So that's a great way to connect with people doing research in the field, other practitioners, kind of like really a really wide variety of people at those conferences. So that might be another way to connect with some of the research happening. We would love to have more research happening.
I have a question of my own. That was the end of what we have, unless somebody else
I think we had a question too.
Question.
Oh, okay, perfect.
Okay. Okay. I was wondering, how do you find that people know about the Integrative Med Center?
How do they find out about
Yes.
things?
How do they find out about you, and how do you see that they get to you?
To get to me particularly, or to
Well,
any
to
modality?
Integrative Med.
To integrative medicine. So usually it's kind of word of mouth. So people talking to each other and saying like, hey, I tried this out. It actually surprised me. It worked better than I expected, and people just connecting with each other oftentimes is the best way. Again, more and more medical centers do have integrative medicine or integrative oncology departments that your oncologist can connect you with. I will say, like, for example, here in the area, how many people are local here in the area? I see a show of hands. Oh, decent number. So like GW has an integrative medicine department, for example, but not necessarily specific to oncology. So that can be another kind of route to things as well.
Thank you so much for the great information.